Skin rashes are very common in children. Most are harmless, but some need medical attention. In this video, I'll help you know when to worry and when it's safe not to. Transient neonatal pustular melanosis is a benign and cell-limited skin condition seen in newborns, often present at birth, or appearing within the first few days of life. It is characterized by small, superficial pustules that lack surrounding redness or inflammation. These pustules rupture easily and leave behind hyperpigmented macules within a thin collarette of scale, which can persist for several weeks or even months. The condition commonly affects the face, neck, trunk, and extremity, and is more frequently observed in full-term infants, especially those with darker skin tone. Importantly, TNPM is not infection, causes no discomfort to the infant, and requires no medical treatment. Parental reassurance and observation are the mainstay of management. Erythema toxicum neonatorum is a very common and harmless skin condition seen in newborn babies. It usually appears within the first 2 to 3 days after birth and presents as red patches with small yellow or white pustules in the center. These lesions most commonly affect the face, chest, and trunk, while the palms and soles are typically spared. The condition is believed to be a normal immune response of the newborn skin involving eosinophil. Importantly, erythema toxicum does not cause pain, itching, or discomfort, and is not an infection. No treatment is required, as a rash resolves spontaneously within 1 to 2 weeks without leaving scar or long-term effect. Neonatal syphilis pustulosis is a benign inflammatory skin condition commonly seen in newborns during the first few weeks of life, and it typically presents as a multiple small pustules on the face and scalp, especially on the cheeks and forehead, without the presence of comedon. This condition is believed to result from an inflammatory reaction to Malassezia species colonizing neonatal skin rather than hormonal stimulation. Infants are usually asymptomatic, with no itching or discomfort. Neonatal syphilis pustulosis is cell-limited and often resolves spontaneous within several weeks without scarring. In more pronounced cases, gentle skincare and short-term topical antifungal therapy may be considered. Overall, the prognosis is excellent, and parental reassurance is the mainstay of management. Miliaria, also known as heat rash, is a common skin condition in infants and young children, especially in hot and humid climates. It occurs when sweat ducts become clogged, trapping sweat beneath the skin. It leads to small red bumps, clear vesicles, or itchy rashes, most commonly seen on the neck, chest, back, and skin folds. Babies are vulnerable because their sweat glands are immature and easily obstruct. Although miliaria can look alarming, it is usually harmless and cell-limiting. Management focuses on cooling the skin, reducing sweating, dressing children in light, breathable clothing, and avoiding excessive heat. With proper care, miliaria typically resolve within a few days without complication. Cradle cap, medically known as infantile seborrheic dermatitis, is a common and benign skin condition in infants. It typically appears as a thick, yellowish, greasy scale on the scalp, but may also involve eyebrow, behind the ears, or skin fold. The exact cause is not fully understood. It is believed to be related to overactive Sebaced glands influenced by maternal hormones and the presence of Malassezia yeast. Cradle cap is not itchy, painful or contagious, and it does not bother the baby. Treatment is usually simple, including gentle scalp washing, soft brushing to remove scale, and occasional use of mild medicated shampoo if needed. Most cases resolve spontaneously within months. Diaper dermatitis, commonly known as diaper rash, is one of the most frequent skin conditions in infants. It occurs in diaper area due to prolonged exposure to moisture, urine, feces, and friction. These factors disrupt the skin barrier, leading to inflammation, redness, and irritation. Secondary infection with Candida albicans is common, especially when the rash persists or worsens. Clinically, diaper dermatitis presents as bright red patches on the convex surfaces of buttock, thigh, and genital area. Prevention and treatment focus on keeping the skin clean, dry, and frequent diaper changes, gentle cleansing, and regular use of barrier creams containing zinc oxide or petrolatum with proper care. Most cases resolve quickly. Neonatal acne is a common and benign skin condition that affects newborns, usually appearing within the first few weeks of life. It presents as a small red papules and pustule, primarily on the cheek, forehead, nose, and sometimes the chin. Unlike adolescent acne, neonatal acne is not related to leukopods or poor hygiene. The condition is believed to be triggered by maternal hormones stimulating the infant's sebaced glands, and in some cases by colonization with Malassezia. Neonatal acne is typically asymptomatic and does not cause discomfort. Most cases resolve spontaneously within several weeks to few months without treatment. Gentle cleansing and avoidance of oily skincare products are usually sufficient, and medications are rarely required. Acrodermatitis enteropathica is a rare but serious genetic disorder caused by impaired zinc absorption due to mutation in the SLC39A4 gene. It usually presents in infants after weaning from breast milk. Clinically, the condition is characterized by well-demarcated, erosive and crusted dermatitis affecting periorificial areas such as the mouth, eye, and anus, as well as the hands and feet. Other key features including chronic diarrhea, irritability, poor growth, alopecia, and increased susceptibility to infection. Without treatment, acrodermatitis enteropathica can be life-threatening. Diagnosis is based on clinical findings and low serum zinc level. Lifelong oral zinc supplementation leads to rapid and dramatic improvement of both skin lesions and systemic symptoms. Atopic dermatitis, commonly known as eczema, is a chronic inflammatory skin disease that frequently begins in early childhood. It is characterized by intense itching, dry skin, and recurrent eczematous lesions. In infants and young children, the rash typically affects the cheek, scalp, and extensor surfaces, while older children often develop lesions in leisural areas, such as the elbow and knee. Disease results from a combination of skin barrier dysfunction, immune dysregulation with Th2 dominant response, and genetic predisposition, including filaggrin deficiency. Environmental triggers such as allergen, irritant, inflammation, infection, and climate changes can worsen symptoms. Management focuses on restoring the skin barrier with regular emollient, controlling inflammation with topical anti-inflammatory agents, and avoiding known triggers. Early and consistent care improve long-term outcomes. Urticaria pigmentosa is the most common cutaneous form of mastocytosis, typically presenting in infancy or early childhood. It is characterized by multiple brownish and reddish brown macules, papules, and plaques on the skin, and key clinical feature is area site, where gentle prickling of a lesion causes redness, swelling, and itching. Due to mast cell degranulation and histamine release, the condition results from an increased number of mast cells in the skin, often related to activating mutation in the KAT gene. In most pediatric cases, urticaria pigmentosa is benign and may improve or resolve spontaneously with age. Management focuses on trigger avoidance, antihistamine for symptom control, and patient education. Incontinentia pigmenti is a rare X-linked dominant genetic disorder that primarily affects females and is usually lethal in males. It results from mutation in the IKBKG NEMO gene, leading to abnormal activation of inflammatory and apoptotic pathway. The disease classically progresses to four continuous stages: vesicular, verrucous, hyperpigmented, and hypopigmentic or atrophic lesion, following the lines of Glasgow. Skin manifestation typically appear shortly after birth. In addition to the skin, the other organs may be involved, including the teeth, eyes, central nervous system, and hair. Early recognition is crucial, as neurological and ophthalmologic complications can be severe. Management requires a multidisciplinary approach and long-term follow-up. Fifth disease, also known as erythema infectiosum, is a common viral illness in children caused by parvovirus P19. It typically begins with mild flu-like symptoms such as low-grade fever, headache, and fatigue. After a few days, a characteristic bright red rash appears on the cheek, giving a slab cheek appearance, followed by a lacy pink rash on the trunk and limbs. The rash is usually not itchy and may recur with heat or sun exposure. Fifth disease is generally mild and self-limited in healthy children. However, it can cause complications in pregnant women and individuals with hemolytic anemia or weakened immune system. Treatment is mainly supportive. Papular purpuric cloth and sock syndrome is a distinctive viral symptom most commonly associated with parvovirus B19 infection. It primarily affects children and young adults. The condition is characterized by a sudden onset of painful or itchy erythema, edema, petechia, and purpura sublimited to the hands and feet, resembling cloth and sock. Patients may also experience fever, malaise, oral erosion, and lymphadenopathy. The rash typically resolves spontaneously within 1 to 2 weeks, without scarring. Although alarming in appearance, the syndrome is generally benign and self-limited. Diagnosis is mainly clinical and may be supported by serologic testing. Treatment is supportive, focusing on symptom relief with antihistamine and analgesic. Salmon patch, also known as never simplex, is a common and benign vascular birthmark seen in newborns. It appears as flat pink to red patches, more commonly located on the forehead, eyelid, upper lip, or the back of the neck. These lesions are caused by dilated capillaries in the superficial dermis and become more noticeable when the baby cries, strains, or is exposed to heat. Salmon patches are harmless not associated with underlying disease, and do not require treatment. Most facial lesions fade spontaneously within the first 1 to 2 years of life, while those on the nape of the neck may persist into adulthood. Parental reassurance is the main management in pork white stain, medically known as nevus flammeus, is a congenital capillary malformation present at birth. It presents as a flat, pink to deep red or purple patch, and commonly affects the face, neck, or limbs. Unlike salmon patches, pork white stains do not fade over time and may gradually darken, thicken, or develop nodular changes with age. The condition is caused by abnormal development of dermal capillaries and is usually sporadic. In some cases, facial pork white stain may be associated with Stuck-Weber syndrome, requiring further evaluation. Early treatment with point-dye laser is considered the gold standard and can significantly lighten the lesion. Mongolian spot, medically termed congenital dermal melanocytosis, is a common and benign pigmented skin lesion seen in newborns, especially in Asian, African, and Hispanic population. It presents as a bluish red to blue-black patch, most commonly located on the lower back and buttocks. The coloration results from melanocytes trapped in the deeper layer of the dermis during embryonic development. Mongolian spots are harmless, non-cancerous, and not associated with trauma or abuse. They usually fade gradually during early childhood and often disappear completely by school age. No treatment is required, and reassurance to parents is the main management approach.